Welcome to this crucial video on senior health. Don't miss these 8 signs of mini strokes in the elderly. IT could save your life. This warning is something every caregiver, family member, and senior must hear. Mini strokes, also known as transient ischemic attacks, TIAs, often go unnoticed, yet they can be the first sign of a more serious stroke to come. As we age, the risk of TIAs increases significantly, and understanding the early warning signs could make the difference between a full recovery and permanent disability. In today's video, we'll dive deep into the 8 critical symptoms you should never ignore and how spotting them early can save lives. These signs can appear suddenly and are often brief, but they are powerful indicators of potential life-threatening strokes in the future. Stay tuned, because knowledge is your best defense. Let's explore the signs together. Sign 1. Sudden slurred or difficult speech. Brain. When speech becomes disordered, think of the brain first. Magnifying glass tilted left, what's happening in the brain? When someone suddenly experiences slurred speech, stuttering, or incorrect word usage, it's likely that the Broca's or Wernicke's areas in the left hemisphere, the language centers, are temporarily deprived of blood due to a TIA, transient ischemic attack. Depending on the location of the damage, the symptoms can vary. Broca's area, motor speech area, the person can understand speech but has difficulty expressing themselves, speaking slowly, word by word, with distorted pronunciation. Wernicke's area, language comprehension area, the person speaks fluently but nonsensically, uses incorrect words, or doesn't understand what others are saying. Magnifying glass tilted right, how to distinguish if this is a mini stroke, not just tiredness? A. Sudden onset. This is not fatigue building up or lack of sleep. The symptoms often occur suddenly, sometimes even while having a normal conversation. B. Clearly changed language. Stuttering, unusually interrupted speech. Mispronunciation, slurred speech. Using wrong words or unable to complete a sentence. Feeling, I know what I want to say but can't say it. C. The person usually doesn't realize. The frightening part is that the person experiencing TIA often doesn't notice the changes in their speech. They believe they are speaking normally. This makes it even more crucial for family members to be vigilant. Pushpin real-life example. A 72-year-old male patient was calling his son when he suddenly stopped for a few seconds and said, "Son, the sun, water, a door." After 2 minutes, he returned to normal and said he was fine. But thanks to his son's vigilance and taking him to the hospital, we discovered this was a TIA affecting his language area. A week later, without treatment, he could have had a full stroke. Brain, what does science say? TIAs affecting the language areas account for about 30 to 40% of all TIA cases recorded. People with a history of high blood pressure, atrial fibrillation, or carotid artery atherosclerosis are especially prone to temporary brain ischemia in this region. A study from the Stroke Journal shows transitory language loss is a clear stroke warning sign, but is often overlooked because the patient appears alert and recovers quickly. Never wait for the symptoms to come back again. A TIA is a warning from the brain, and language is the first alarm bell. Act before the opportunity is lost. Mobile phone with arrow, take action immediately if you see this sign. Call emergency services 115. Observe the time the symptoms began. Do not let the person rest in place because they seem fine. Record the unusual speech, if possible, to make it easier for the doctor to assess. Sign 2. Sudden facial droop. A warning of stroke in the brainstem or motor cortex. Brain. When one side of the face can't smile, it might be when the brain is not receiving enough blood. Magnifying glass tilted left, why does the face droop in a mini stroke, TIA? Our face is controlled by the cranial nerve 7, also known as the facial nerve. This nerve controls the muscles that help us express emotions, smiling, frowning, raising eyebrows, closing our eyes, etc. Backhand index pointing right, when blood flow to the brain is temporarily interrupted, particularly in the brainstem or the motor cortex. The signals from the brain to the facial muscles are blocked, leading to one side of the face drooping. Inability to close the eyelid on the affected side. The mouth becoming crooked. A crooked smile, one side raised, the other not. Pushpin, the difference between TIA and Bell's palsy, peripheral facial paralysis. Characteristic TIA, mini stroke, Bell's palsy, 7 nerve palsy. Location of damage, central, Brain, peripheral, facial nerve. Forehead muscle function normal inability to wrinkle the forehead. Danger level very high. May precede a severe stroke, typically benign, recovers in weeks. Onset time sudden, temporary, minutes to 1 hour sudden, but lasts longer. Backhand index pointing right. Quick tip to differentiate. Ask the person to wrinkle their forehead. If they can still wrinkle their forehead, but the mouth is crooked, it could be a TIA, very dangerous. If they can't wrinkle their forehead or make a normal smile, it might be Bell's palsy, less dangerous, but still needs to be checked. Bar chart. What do studies say? According to the American Academy of Neurology, facial droop on one side accounts for 38 to 50% of confirmed mini-stroke cases via MRI. This is one of the most commonly overlooked symptoms because it recovers quickly, especially in older adults. Man health worker real-life situation case study. A 68-year-old female patient was making tea when her daughter noticed that her mouth was slightly crooked. She was still talking normally, saying, "Maybe I slept in the wrong position." 20 minutes later, everything returned to normal. But thanks to her daughter's insistence on seeking medical attention, doctors discovered she had just experienced a TIA in the brainstem. Just 5 days later, without treatment, she could have suffered a full stroke. Bell facial drooping often accompanies these symptoms. Difficulty speaking, slurred or unclear speech. Weakness in the arm/leg on the same side. Difficulty closing the eye on the affected side. Drooling on one side. Numbness or tingling in the cheek. Mobile phone with arrow. What to do immediately if you notice these signs. White heavy checkmark. Call emergency services right away. Don't wait to see if it comes back. White heavy checkmark. Lay the person on their side safely. Do not allow them to walk on their own. White heavy checkmark. Note the time the symptoms began. Every minute counts. White heavy checkmark. Take a picture of the face if possible. This can assist doctors in diagnosis. Facial drooping is not a small issue. When one side of the face cannot smile, cannot wrinkle the forehead, it's no longer just a muscular problem. It's a blood flow issue to the brain. And if you notice it within the first few minutes, you could save a life behind that smile. Sign 3. Weakness in one arm or leg. An urgent message from the brain. Brain, when your hand can't hold a glass or your leg can't step firmly, think of the brain first. Magnifying glass still to the left. Why does a mini stroke, TIA, cause weakness in one arm or leg? In the brain, the motor cortex is responsible for controlling movement. Each hemisphere controls the opposite side of the body. Left hemisphere controls the right arm/leg. Right hemisphere controls the left arm/leg. When a small blood vessel supplying the motor cortex is temporarily blocked, the brain loses control signals to the spinal cord and muscles, leading to temporary weakness or paralysis in the arm/leg. Pushpin. How does this present itself? White heavy checkmark. Weakness in the arm. Dropping objects suddenly when holding them. Unable to hold a toothbrush, water glass, etc. Cannot lift the arm to shoulder height. One arm feels like it no longer belongs to you. White heavy checkmark. Weakness in the leg. Walking lopsided or leaning to one side. Difficulty lifting the foot to step upstairs. The leg feels soft, like it has no bones, or shakes uncontrollably. The foot drags or scrapes the ground when walking. Bar chart. What do neurological studies say? According to the Journal of Neurology, over 70% of TIA patients have weakness in one arm or leg as the first sign. Muscle weakness can last from a few minutes to 1 hour, but it signals the risk of a full stroke within the next 48 hours at a rate of 10 to 15% if not treated. Round pushpin home test tip, equivalent to step A in the FAST test. Raised hand, raise both arms, test. Ask the person to raise both arms to shoulder height, palms facing up, and hold for 10 seconds. Magnifying glass still to try to observe. If one arm drops slowly or shakes lightly, it may be mild weakness from a TA. If the arm drops quickly and cannot be held up, this indicates a higher risk of serious brain damage. Warning: distinguishing stroke-induced muscle weakness from other causes. Cause: muscle weakness characteristics. Mini stroke, TI, sudden onset, localized on one side. No pain, may recover quickly. Herniated disc pain with weakness, worsens with neck/back movement. Hypoglycemia, generalized weakness, accompanied by sweating, hand tremors, confusion. Carpal tunnel syndrome, finger weakness, tingling, does not affect the legs. Mobile phone with arrow. What to do if you notice this sign. White heavy checkmark. Call emergency services immediately. 115. Even if the person feels better. White heavy checkmark. Do not let the person stand or walk. There is a risk of falling and a real stroke happening in the next hour. White heavy checkmark. Note the time symptoms started. This helps doctors decide on interventions, e.g., thrombolytic drugs. White heavy checkmark. Do not give blood pressure medication or aspirin randomly. It may lower the blood pressure too much or cause bleeding if the diagnosis is incorrect. Man health worker real-life situation case study. A 72-year-old man was pouring tea when his right hand dropped the cup without control. His wife thought he was just tired, but 15 minutes later, when he stood up, his right leg gave out and he almost fell. The family thought it was due to joint degeneration. The next morning, he suffered a full stroke and could no longer speak. That was a missed warning of a TI. Weakness in one arm or leg is not always age-related or due to joint problems. When it happens suddenly, with no pain, it's the brain's urgent language. And you only have a few minutes to listen before the brain stops speaking. Sign 4. Language disturbance or slurred speech. When speech suddenly goes out of rhythm, that's when your brain is slipping out of control. Magnifying glass tilted left. Why does TIA cause slurred speech or loss of language? Language is controlled by the Broca's and Wernicke's areas located in the left hemisphere of the brain in right-handed people. Broca's area controls the ability to pronounce words and form sentences. Wernicke's area understands language and selects appropriate words. Backhand index pointing right. When the blood flow to these areas is temporarily blocked due to a small blood clot or vasospasm, the brain loses the ability to transmit signals to control speech. You may slur your speech, repeat words, or be unable to speak. Pushpin specific signs to watch for. White heavy checkmark. Loss of speech, aphasia, unable to find the right words, using the wrong words, mixing up meanings. Pin becomes hat, tea becomes car, opening your mouth but unable to form a complete sentence. White heavy checkmark. Slurred speech, dysarthria, mumbled speech, sounding like someone is drunk. Words are unclear, speaking slowly and in a fragmented manner. Family members may feel the speech no longer sounds normal. Index pointing up important. If slurred speech occurs suddenly, without sleepiness or cold-like symptoms, it could very well be a sign of a TI. Test tube distinguishing from other disorders. Language disorder typical characteristics. TIA/mini stroke sudden onset, no warning, may be accompanied by weakness in one arm/leg. Alzheimer's/dementia gradual progression, frequent word-finding issues, but still pronounces words correctly. Stress/panic slight, speech hesitation, fragmented due to rapid breathing, but no slurring. Previous stroke recovery slurred speech that has been persistent, not newly appearing suddenly. Brain and death warning. According to the American Stroke Association, AHA, over 30% of TIA cases begin with language symptoms. Especially in older adults, slurred speech is often misunderstood as aging or fatigue. Ignoring this symptom means many miss the golden window to prevent a real stroke from happening within 24 to 72 hours. Mobile phone with arrow. Quick home check. Say something simple. Ask the person to say a simple sentence, e.g., "The weather is beautiful today." Magnifying glass tilted right. Observe. Do they pronounce the words correctly? Are they repeating words, slurring, or using incorrect words? Does the sentence flow smoothly? Skull and crossbones. If they can't respond or the response is very strange, immediately call emergency services. Don't wait for them to rest and feel better. Men health worker real-life situation. A 68-year-old woman was talking to her son on the phone. Suddenly, she said, "Go car, ribs, broom, son." No one could understand. Everyone thought she was joking. 10 minutes later, she was back to normal. The next day, she suffered a real stroke, permanently damaging the Broca's area. She could never speak fluently again. That was a TIA that the whole family missed. Speech is one of the most delicate functions of the human brain. When you suddenly can't speak a full sentence, your brain is screaming for help. Don't let negligence make the voice fall silent forever. Sign 5. Sudden loss of balance or dizziness. It's not just dizziness. It could be a sign that your brain is about to be attacked. Magnifying glass tilted left expert perspective. What's happening in the brain? When a TI occurs in the cerebellum or brainstem, areas responsible for maintaining balance, coordinating eye-ear limb movements, postural reflexes, and maintaining body alignment. A sudden loss of blood flow to these areas prevents the brain from processing signals about direction, gravity, and body position, leading to dizziness, lightheadedness, or complete loss of balance. Pushpin distinctive signs. White heavy checkmark sudden spinning dizziness. Feeling like everything is spinning even when standing still. Not the same as lightheadedness when standing up quickly. May be accompanied by nausea and cold sweats. White heavy checkmark loss of balance while walking. Suddenly walking unsteadily like being drunk. Needing to hold on to something to stay upright. Feeling like your legs aren't connecting to the ground, stumbling. White heavy checkmark inability to distinguish direction. Not knowing which way you're tilting. Unable to control your body when turning your head or closing your eyes. Skull and crossbones. The risk of falling is extremely high, especially for the elderly, leading to potential head injuries or hip fractures. Bar chart distinguishing from other causes. Condition dizziness characteristics. TIA/mini stroke sudden onset, often accompanied by loss of coordination in limbs, double vision. Vestibular disorder spinning sensation, but often recurring, lasting several hours. Low blood pressure/hypoglycemia lightheadedness, but improves when lying down. Sleep deprivation/anxiety floating sensation, unclear direction. Microscope quick clinical examination, tilt TO one side test. When suspecting a TIA in the cerebellum, neurologists often perform simple tests like finger-to-nose test. The patient closes their eyes and reaches their finger to their nose. They will stumble if there's coordination damage. Walking in a straight line test. Ask them to walk along a straight line. TIA patients tend to veer off to one side. Pushpin special warning. If dizziness lasts for a few minutes and then passes, IT does not mean it's safe. It could be a sign of an impending cerebellar TI, which has the potential to develop into a brainstem stroke within the next 72 hours. Extremely dangerous, and the fatality rate is high without timely emergency care. Men health worker real-life situation. A 75-year-old man, otherwise healthy, suddenly felt wobbly like being on a boat while walking. His family thought it was just vestibular, so they let him rest. 6 hours later, he had weakness on one side of his body and slipped into a coma from a brainstem stroke, an area extremely dangerous and hard to treat. If he had been taken to the hospital immediately when the first symptoms appeared, the consequences could have been prevented. Temporary dizziness is not just fatigue. In the elderly, it could be the final alarm from the brain before a stroke strikes. Every second you delay, millions of brain cells die and can never be restored. Sign 6. Blurred vision or temporary loss of vision. Blurred vision or temporary vision loss could be a sign of a transient ischemic attack, TI. Don't ignore it, as it could be a warning symptom of an impending stroke. Magnifying glass tilted left expert perspective. What's happening in the brain? Our vision is controlled by the occipital lobe, the part of the brain responsible for processing visual information through the optic nerve. When blood flow to this area is reduced, the neurons in the occipital lobe do not receive enough oxygen and nutrients. This can lead to temporary blurred vision or complete vision loss for a short period of time, especially when blockage or ischemia occurs in the major blood vessels supplying blood to the eyes and vision. Pushpin distinctive signs. White heavy checkmark temporary blurred vision, usually in one eye. The patient feels like their vision is cloudy or obscured for a few seconds to a few minutes. It feels like there's a fog over the eyes or partial vision loss in certain areas. It typically happens in one eye, rarely affecting both eyes at the same time. White heavy checkmark temporary vision loss in one eye. The sensation of not being able to see from one eye while the other eye remains normal. Sometimes patients describe it as a black curtain blocking vision in one eye, or as if their glasses suddenly fogged up. Warning. This temporary blurred vision or vision loss usually lasts only a few minutes. But even if it's temporary, it can still be a sign of a TI, a dangerous condition that requires urgent medical attention. Brain differentiating from other causes. Cause characteristics of blurred vision. TIA, transient ischemic attack, temporary blurred vision in one eye, lasting seconds to minutes, without pain. Stroke, sudden vision loss. may be accompanied by weakness on one side of the body or slurred speech. Migraine blurred vision with a headache may include nausea or sensitivity to light. High blood pressure, retinal artery occlusion, sudden vision loss in one eye, with eye pain or other symptoms like eye bleeding. Bar chart impact of ischemia. In the case of ischemia, TIA, if the ischemic event lasts longer, it could lead to permanent brain damage. However, temporary vision loss in this case serves as a signal for the body to indicate a vascular issue in the brain, especially for high-risk individuals such as the elderly, those with cardiovascular disease, or a history of strokes. Red circle sudden blurred vision is often a sign that the blood vessels supplying oxygen to the brain are having problems. You should not ignore this symptom. If left untreated, the condition could worsen, leading to a stroke or blood vessel occlusion, making recovery more difficult. Syringe how to check quickly. One simple test that neurologists can perform is checking the pupil reflex and conducting a visual function exam to look for differences between the two eyes. The patient will be asked to focus on an object at a distance of 20 to 30 centimeters, and the doctor will examine the speed of eye accommodation and check the pupil reflex. Police car light when to go to the hospital immediately. If you experience blurred vision or temporary vision loss, especially if accompanied by other symptoms such as weakness or numbness on one side of the face, arm, or leg, difficulty speaking or understanding speech, severe headache or dizziness, immediate emergency care is required. This could be a sign of a TIA or an impending stroke, and timely intervention can save your life. Mental health worker real-life situation. A 78-year-old woman was watching TV when she suddenly noticed her left eye becoming blurry for 2 to 3 minutes, but it cleared up afterward. She didn't pay much attention, thinking it was just eye strain. However, a few days later, she had trouble speaking and weakness on the right side of her body. When she was taken to the hospital, doctors confirmed that she had experienced a TIA due to a small blood vessel blockage in her brain. Blurred vision or temporary vision loss is not a symptom of fatigue or poor eyesight. It's a warning that your brain is in serious trouble. Don't ignore it. Seek medical attention immediately if you experience this symptom. Important note: TIA or stroke can occur in anyone, especially older adults. The sooner you identify and treat the condition, the higher the chance of recovery and reducing the consequences. Remember, every second you delay seeking emergency care could be the deciding moment for your life and quality of life afterward. Sign 7. Difficulty speaking or understanding speech. Difficulty speaking or understanding speech is a serious sign of a stroke, which may be related to the loss of language function or affect the patient's ability to communicate. Magnifying glass tilted left expert perspective. What's happening in the brain? When we speak or listen, we use specific areas of the brain related to language and communication, primarily the Broca's area in the frontal lobe and Wernicke's area in the temporal lobe. These areas help us produce speech and comprehend the meaning of words spoken by others. When one of these areas is affected by blockage or ischemia, the ability to speak or understand speech is severely impaired. Especially in the case of a transient ischemic attack, TI, or stroke, if blood is not sufficiently supplied to these areas, it can lead to difficulty speaking or understanding speech, a condition known as aphasia. Pushpin distinctive signs. White heavy checkmark, difficulty speaking. The patient may have difficulty pronouncing words or speaking clearly, leading to stuttering or an inability to finish sentences. They may exhibit slurred speech, with words becoming disordered and not forming clear sentences, or may not be able to speak any words at all. When blood vessels affecting the Broca's area are blocked, the patient may struggle to form speech, although their ability to understand others' speech remains normal. White heavy checkmark, difficulty understanding speech. The patient may not fully understand what others are saying, even though their hearing is unaffected. Sometimes the patient can understand part of the speech, but cannot fully interpret the meaning of a sentence or the context of the conversation. When damage occurs in the Wernicke's area, the ability to understand language is severely impaired, even though the patient may still speak, but their speech will be meaningless or jumbled. White heavy checkmark, loss of ability to coordinate language with action. Not only can the patient struggle with speaking or understanding speech, but they may also face difficulty in performing communication-related actions like writing or reading. The patient may be unable to read words or write coherent sentences, even though they can still recognize the vocabulary. Warning, warning. Difficulty speaking or understanding speech is not a normal symptom of fatigue or stress. If it occurs suddenly, accompanied by other signs such as muscle weakness, loss of balance, or severe headache, it could be a sign of TIA or a stroke. Brain physiological mechanisms of language loss. Broca's area. Located in the frontal lobe, Broca's area controls speech production. When blood flow is blocked or reduced to this area, the patient may be unable to pronounce words properly or connect words together into complete sentences. This is often seen in non-fluent aphasia, where the patient can understand speech but cannot speak clearly or continuously. Wernicke's area. Located in the temporal lobe, Wernicke's area is responsible for language comprehension. When blood is not adequately supplied to this area, the patient may speak very fluently, but their sentences will be nonsensical or made up of random, unrelated words. This leads to fluent aphasia, where the patient continues to speak, but what they say cannot be understood. Bar chart risk factors. Several factors can increase the risk of aphasia and stroke or TIA, including high blood pressure or cardiovascular disease, increasing the risk of blood vessel blockage; diabetes, damaging small blood vessels in the brain; smoking and alcohol abuse, increasing the risk of blood clot formation; genetic factors, or a family history of stroke. If the patient has any of these risk factors, difficulty speaking or understanding speech should be considered an emergency. Police car light when to go to the hospital immediately. If you or someone you know is experiencing difficulty speaking or understanding speech, especially if accompanied by other symptoms such as weakness or numbness on one side of the body, difficulty maintaining balance or dizziness, temporary vision loss or blurred vision, severe or sudden headache, immediate emergency care is required. Don't hesitate. The sooner you get help, the higher the chance of recovery. Men health worker real-life situation. A 75-year-old man was talking with his family when he suddenly had difficulty pronouncing words and could not finish a sentence. Despite his efforts, he couldn't connect words together. His family took him to the hospital immediately, where doctors confirmed he had experienced a TIA. Without timely intervention, the situation could have led to a stroke and permanent damage to his language ability. Difficulty speaking or understanding speech is not a normal symptom, and it could be the first sign of a stroke. Don't ignore these signs, as timely intervention can save your life or the life of a loved one. Important note: symptoms like these are not just temporary issues, but could be a sign of a more serious problem occurring within the body. Quick and timely identification can help minimize long-term damage and even save lives. Sign 8. Dizziness or loss of balance. Dizziness and loss of balance can be signs of a stroke, especially if they occur suddenly and are accompanied by other symptoms. Magnifying glass tilted left expert perspective. What's happening in the brain? Dizziness and loss of balance are symptoms we often experience in daily life, but when they appear suddenly and are associated with other factors like muscle weakness or vision loss, they could be signs of a stroke or TI, transient ischemic attack. Dizziness and loss of balance may result from reduced blood flow to areas of the brain that control balance functions. These areas are primarily located in the cerebellum, which coordinates movement and balance, and the temporal lobe, which helps maintain cognitive functions and adjust the body. When one of these areas is affected by blood vessel blockage or ischemia, dizziness and loss of balance may occur. Pushpin distinctive signs. White heavy check mark, sudden dizziness. A spinning sensation or feeling unsteady, making it difficult for the patient to stand or walk. Dizziness is not just a mild feeling, but an uncontrollable sensation, as if the person is about to fall. Sometimes the patient may feel lightheaded, especially when trying to move or suddenly changing position, e.g., from sitting to standing. White heavy check mark, loss of balance. The patient may feel as if they cannot control their body when moving or standing. Walking becomes difficult, and they may need support from others to maintain stability. The patient may be unable to walk straight. Their body may tilt to one side when standing, and sometimes they may fall without any clear reason. White heavy check mark accompanied by other symptoms. Dizziness and loss of balance often accompany other stroke symptoms such as muscle weakness, numbness on one side of the body, difficulty speaking or understanding speech, blurry vision or temporary vision loss. These symptoms may appear suddenly and usually last for a short time. But don't take them lightly, as they could be signs of an impending stroke. Brain physiological mechanisms. Cerebellum and the balance system. The cerebellum plays a crucial role in maintaining balance and coordinating movement. If blood flow to the cerebellum is interrupted, dizziness and loss of balance may occur suddenly. Specifically, if a stroke affects the blood vessels supplying the cerebellum, the patient may feel unsteady or unable to maintain a stable posture. Temporal lobe cortex and spatial awareness adjustment. A part of the temporal lobe cortex is responsible for coordinating balance and spatial awareness. If this area becomes ischemic, the patient may feel like they no longer have a sense of their surrounding space, leading to loss of balance. Damage to blood vessels in these areas can cause dizziness or loss of coordination, making movement dangerous. Bar chart risk factors. Several factors can increase the risk of dizziness and loss of balance during a stroke or TIA, including high blood pressure. Elevated blood pressure can increase the risk of blood vessel blockage, especially in areas that coordinate balance. Cardiovascular disease, arrhythmias, or atherosclerosis can lead to blood clots, obstructing blood flow to the brain. Overwork or stress. Though less common, physical and mental stress conditions can cause dizziness, especially when accompanied by fatigue or dehydration. Police car light when to go to the hospital immediately. If you or someone you know is experiencing dizziness or loss of balance, accompanied by any of the following symptoms: weakness or numbness on one side of the body, arm, or leg, difficulty speaking or understanding speech, temporary vision loss or blurred vision, severe or sudden headache, immediate emergency care is required. This could be a sign of a TIA or stroke, and immediate treatment is necessary to reduce permanent damage. Mental health worker real-life situation. An 82-year-old woman suddenly felt dizzy and lost her balance when standing up. She was unable to walk and felt as though she was about to fall. Her family took her to the hospital immediately, and doctors diagnosed her with a TIA, a type of mild stroke. Without timely intervention, the condition could have led to a more severe stroke, with long-term complications. Dizziness and loss of balance should not be ignored, especially when they appear suddenly and are accompanied by other stroke signs. The sooner you get emergency care, the higher the chances of recovery. Important note: symptoms like these are not typical for regular dizziness and may signal a serious underlying issue in the body. Quick and timely identification can help minimize long-term damage, even preventing death. Time is everything. The danger with TIA is the symptoms usually go away within an hour, and that's why people often underestimate it. But the truth is, TIA is a warning before a real stroke. Don't hesitate. Don't second-guess. If you even suspect it, call emergency services immediately. Better safe than sorry. People over 60 are at the highest risk, especially if they have factors like high blood pressure, diabetes, cardiovascular disease, heart arrhythmia like atrial fibrillation, smoking, high cholesterol. Even healthy individuals can experience TIA. That's why understanding is your first line of defense. If you suspect TIA, do the following. Heavy checkmark, call emergency services 115 immediately. Heavy checkmark, do not let the person rest it off. Heavy checkmark, remember the time the symptoms began. Every minute counts. Heavy checkmark, request a CT or MRI scan of the brain to rule out a real stroke. After that, the doctor may prescribe blood thinners, blood pressure control, lifestyle adjustments to prevent a serious stroke from occurring later. TIA is not a small issue. It's your body's warning, gentle yet serious. It's the final opportunity before everything becomes irreversible. Don't take it lightly. Don't ignore it, because the next time, it may not be a mini. This video doesn't just provide information, it could save a life. So don't just scroll past. Share it, remember it, and become the brave one who takes action when time is precious. Thank you for watching this essential guide on Don't Miss These 8 Signs of Mini Strokes in the Elderly. IT could save your life. If you or a loved one is experiencing any of these symptoms, it's vital to seek immediate medical attention. The quicker you act, the better the chances of a full recovery, and you could prevent a major stroke from occurring. Don't forget to subscribe for more valuable health insights, and share this video with friends and family who may need to be alerted to these important signs. Your health and well-being are too precious to ignore the warnings. Stay aware, stay safe, and remember, Early intervention can save your life.